Hi, I'm Dr. John Flucke with Dental Products Report, and today I'm going to be having a discussion with Dr. Kent Howell, who's in Mesa, Arizona. And Dr. Howell has been using the Versamill milling system in his practice for just about a year and a half now, and he's going to spend a little time with us today, kind of giving us the good things about this system, why he likes it, what he's accomplishing, and that sort of thing. So Dr. Howell, thank you very much for joining us today.
My pleasure. Thanks for having me.
Sure. As far as the Versamill, I know that there are obviously a lot of mills on the market nowadays, and those mills will do a lot of incredible things. And I was curious if you could tell me, just to start off with, what was the differentiator for you between the Versamill 5X that you use every day, and why did you pick that one over the competitors?
Great question. That's kind of the million-dollar question. And the technology grows like crazy, and we really have to find the right technology for what we want to do in practice. And so what I love about the Versamill 5Xs, it's kind of the little brother to a lot of the bigger machines. They have a whole line, of course. Some of the bigger ones are like what Argan uses. They use their larger machines to mill 24 hours a day. I chose this machine because several reasons. Number one, it's truly open. I use Hyperdent, which is the CAM software that tells the mill what to do, and it's a true 5-axis mill with extreme accuracy. It allows me to mill anything that comes in a 98 millimeter puck that's not metal. My particular machine doesn't mill metal, which is perfect for me as a prosthodontist. Having that ability to do CAD design and mill it in-house is invaluable. And I can mill Emacs, I can mill PMMA, I can mill a lot of the new CAD/CAM materials that are not metal, pectin, trinia, trilor, all those types of things, wax. And it's a wet mill. It can be a dry mill or a wet mill. I use it as a wet mill, which really cuts down on the noise. There's no vacuum. It's a heck of a lot cleaner for zirconia. There's no powder. It's very simple to clean, and it gives me a great product.
Well, and I think that's the important thing is you can spend a lot of money or save a lot of money, but in the end, what really affects us in our profession is what are we using it for with the patient, and what kind of a result do you get with the patient. And I know when I got a chance to see the 5XS in Chicago this year at the midwinter meeting, I was really impressed with the quality of what I saw coming out of that machine. One of the questions I have for you, Dr. Howell, is I heard you mention the pucks, and that is something I think that people should know, is that this machine will either mill pucks, or it will mill individual blocks, similar to other mills on the market. Have you used any of the blocks that are out there, like the 3M Lava Ultra, the lithium disilicate from Ivoclar?
Yeah, absolutely. My workhorse is zirconia and lithium disilicate blocks, and that's another beautiful thing about it. Other than it uses a little bit different of a coolant. It's very simple to switch out and switch from Emacs to zirconia and just kind of on the fly. It mills it very quickly, very predictably, and it's a great product. Really, anything that comes in my particular mill, anything that comes in a CEREC type handle on the block, you can use in this machine, and you can mill it as long as you have the correct templates. And that's one of the greatest things about Axsys Dental Solutions is their support is amazing. There's quite a learning curve if you get into milling of any kind, and they were there for me all along the way. Really helped me to really fine-tune the things I wanted to do and the boundaries that I wanted to push.
As far as the ability to mill things in the puck for larger durations, being a prosthodontist, do you find that that's a real advantage? Because I think one of the things that doctors tend to think about, if you don't know a whole lot about this this particular piece of dentistry right now, is people think, oh, I could do a 3-unit bridge maybe in a longer block size. But with the pucks, you literally could do an entire upper arch and a lower arch if you wanted to, completely do them in, 12 units, 14 units, whatever it is. Is that something that you find that's really advantageous with what you do?
Absolutely, and that was a game changer for me. Quite honestly, was a kind of a driving point for me getting the mill. I do a lot of full arch implant dentistry, a lot of all-on-4s. My particular prosthesis choice is a frame with individual preps on it with zirconia crowns. I like that for lots of different reasons, for maintenance and other things, and that allows me to get 2 full arches of crowns, at least 20 to 24 crowns on one puck, one 98 millimeter puck of zirconia. And what that allows me to do is to be more competitive in my area and actually pass on those savings to my patients, because I'm not relying on high lab bills and things of that nature. I can fabricate some of that stuff on my own, and kind of subsequent, use the process in my office to help kind of facilitate that. And I actually teach some courses on all-on-4 treatment and some of these lab courses, and it's really helped me to become an expert in that side of the lab work. I think it's very important that dentists understand the lab side, and we know what it takes to provide quality restorations in the digital world today. It's very important.
You mentioned also, as we were getting started, the words open source, and I know that's something that's near and dear to my heart, that I've been preaching for about, I don't know, 5 or 7 years as we got into this somewhat. And to kind of give that a quick description is so that our listeners and viewers can understand, that is, when a system will talk to any other system on the market. So what are you using currently, Dr. Howell, to scan the cases and then send into the design software?
Yeah, absolutely. I have 2 intraoral scanners. I started with a 3M TrueDepth scanner, which is a very accurate, I loved it. It was kind of my beginner scanner. I also have a Trios intraoral scanner, and that's probably the one I use the most. I also have a desktop scanner. It's the DOF HD. It's actually right behind me on my left here. And that's what I do for a lot of my full arch cases I'm scanning. I use exocad primarily for my CAD design, and then I use Hyperdent to nest the parts in the puck for my Versamill to mill. And so that's my workflow, all of which are open, and all of which really allow me to have the freedom to do anything I want with any of those files to get the product that I want.
So from a practicality standpoint, let's say somebody comes into your office and they've had some type of traumatic injury to 8 and 9, for instance. How long would it take you, on an existing patient, someone you've already done the health history workup and all of that? If someone were to walk in and say, "Oh my gosh, I've broken my 2 front teeth, I can't go out in public," how long would it take you to get that to a completed case? Do you have any idea on that?
Yeah, I don't do a ton of same-day stuff, but I could do it if I wanted to do it. My workflow in my office doesn't work very well for that. But I could mill, for instance, a lithium disilicate crown probably in 15 minutes with the Versamill. If I had an oven and I had the skills to stain and glaze and do those things that I would want to do at that level, that may be another half hour, 45 minutes. And so you could easily turn those things around. If you have a zirconia oven, you could do the same thing with zirconia. But zirconia has a lot longer firing cycle, and so doing a same-day type thing is difficult to do in that scenario unless you're milling, sintered blocks already. But those are, that technology is coming, and we'll see how good it gets.
Yeah, that's something that I think is really fascinating right now. And the other piece of it that I think is interesting to see where we go is the ability to actually mill an implant and then mill all the parts in-house as well, which we're not there yet.
Right.
But won't that be an incredible thing, just to sit down and not have to have a parts inventory anymore, simply create the parts as you go?
Yeah, I mean, the sky's the limit. The technology is moving so fast, it's going to be unbelievable where it is in 5 years from now.
So with Axsys Dental Solutions, I know that there's a lot of stuff to learn about these when you first get into this. What has the learning and teaching support been like from the company to you and your staff?
It's been fantastic. When I bought my mill, I went to their facility there in Michigan for a 2-day training course. We learned hyperdent and kind of how to maneuver it, and the mill itself. We milled some things, got comfortable with the mill itself and how to change the discs out and run the programs and things of that nature. When it arrived at my office shortly after that, it was literally, take it out of a crate, set up a couple things, and it's ready to go, which was fantastic. Made it very simple to hit the ground running. At that point, I just played with it. We milled some things. I got a feel for, how long things take, what's the sequence, how to calibrate it, make sure, you're keeping track of your tool life. And that's an important thing, is making sure your tools are appropriately sharp and you're still getting that accuracy that the mill can provide. And so a lot of that learning curve just came from just diving into it and getting some repetition there. I probably called them for a long time, almost every day, every other day at least, to really kind of help me shore up my skills and make sure I was doing it right. And they were fantastic.
Well, that's great to hear, because the one thing I think you don't want to hear in a situation like this is that it was a long learning curve, that I had trouble, getting support from the company, because this is a major investment in both, time and treasure. And I'm glad to hear that, because that is, that's the secret to the success with this. Is there's no doubt that we have more than one device on the market that can do these kind of things, but you really kind of get down to what can the manufacturer teach you and how can they support you and help you provide the best you can for your patients. I think that is a huge, huge advantage in situations like this.
I would argue that support is arguably the most important part of the puzzle, because you can have all the fanciest whatever, and if you don't know how to use it to its capability, it's useless to you.
Yeah, I completely agree with that. I also love the fact that you can mill just about anything with this. And you said beforehand, you can do wax if you want to use lost wax technique. You can do zirconia, PMMA, ceramics, lithium disilicate, lava. I mean, there's just a huge number of different materials that you can use, that you're not limited in just doing one or two. You look at the patient, you determine what the patient needs, and then you simply go from there. There's no, well, okay, here's what the patient needs, here's what I can provide. Now let me think of where's the compromise come into this, where I now take what I can do versus what they need, and make those things match. This is what they need, this is what we use. I think that's a tremendous advantage to a device like this.
I agree completely. That's one of the most fun things about going to, I like to go to Lab Day Chicago and just kind of oogle and awe at everything that's there. And that's what my eyes are looking for, is new materials, and what forms do they come in, how do you mill them, what you can use them for. And it changes so quickly that you really have to stay on top of that, because not everyone is the same, and you do have to tailor that to people.
Great. Well, thank you so much for spending some time with us. I think this has been a tremendously educational little piece of video we've gotten here. I've been having a conversation with Dr. Ken Howell from Mesa, Arizona, about the Versamill 5Xs. I'm Dr. John Flucke with Dental Products Report. Thank you guys for watching. We'll see you again.